impact of this virus, while we also better aligning us with our neighboring counties. It will provide appropriate lead time to prepare businesses and industries to reopen safely, and will equip them with the tools they need to align with the guidelines. The new metrics for the state account for the high volume of testing in Los Angeles County is already performing and does not diminish our testing compared to other jurisdictions. We continue to have a robust testing protocol in place. As our numbers continue to drop significantly, this structure provides a roadmap for our reopening priorities. I hope with this new guidance, we can also prioritize getting our children back to school. While we continue to make investments in remote education, it cannot replace in-person classroom learning for many of our students. This is especially true for those with special needs, English learners, and younger children in elementary school, which the state has prioritized as the most in need of in-person teaching. As we continue to face this pandemic, we all have a part to play to keep our community safe and continue to slow the spread. We all know the best way to protect yourselves and those around you is to limit interactions with other people as much as possible and to take precautions to prevent getting COVID when you're interacting with others. This is especially important for people at increased risk of severe illness from COVID-19, which includes individuals 65 and older and those with underlying health conditions to protect themselves from contracting this virus. We encourage everyone to continue to use the tools we know are effective. Wear a face covering, wash your hands, keep 6 feet apart, and stay home if you are feeling ill. As we've navigated this pandemic, businesses have overcome serious challenges. To assist them during this time, the county is providing additional resources and extra support. The LA COVID Fund provides grants between $5,000 and $25,000 for small businesses, micro-entrepreneurs, chambers of commerce, nonprofits, with almost $100 million total allocated. The 4th round opens today and will last through this week. Once you apply, you will remain in the system for future rounds and will not need to submit another application. For more information on the fund and to apply, please visit LA Regional COVID Fund website at lacovidfund.org. Again, lacovidfund.org. In addition, we are working hard with community groups to support vulnerable residents. Providence, Southern California recently donated $1 million to meet the mental and physical health needs of people experiencing homelessness. Providence is partnering with the public and private organizations to expand services during COVID-19. The funding, in addition to an earlier $1 million contribution, will enable access to on-site health care at Project Room Key locations in the San Fernando Valley, which reserves hotel rooms as temporary housing solution for those that are experiencing homelessness. Across Los Angeles County, 16 nonprofit community-based organizations will receive grants to provide health services at our Project Room Key sites. This is another positive example of the way public and private organizations are joining forces to support our communities during COVID. With that, I would like to invite Dr. Davis up to give you the weekly count. Thank you.
Thank you, Supervisor Barger, and to the entire Board of Supervisors. Our county continues to move in the right direction in slowing the spread of COVID-19, thanks in large part to your leadership. Thank you for joining me today. I want to acknowledge first off that today is International Overdose Awareness Day. For anyone who is struggling with substance abuse, please know there is help available. You can call the Substance Abuse Service Helpline at 1-844-804-7500 to be connected to help. And I also want to acknowledge all of those who are working with those who have substance use. We thank you for your service. I want to talk today about the new framework that was released by the state and how it impacts Los Angeles County and our process for reopening. I also want to talk a little about what we talked about last week, and that is learning from our recent past and taking action that will prevent spikes in cases, hospitalizations, and deaths, especially as the Labor Day weekend approaches. Let's show the first slide. On Friday at midday, the state announced a new tiered framework to more easily communicate the extent of community transmission in counties across the state. This slide shows a summary of the state's tiers, the indicators they are tracking, and how counties are being classified as having either widespread, substantial, moderate, or minimal spread of COVID-19 virus in their communities. They will use this tier system to guide possible sector reopenings for each county to consider. However, the ultimate decision about sector reopenings will remain under the purview of the county health officer orders that are developed in consultation with our Board of Supervisors. If we can go to the next slide. Los Angeles County is currently in Tier 1, meaning that there continues to be widespread transmission of the virus in the county. Per the state, our current number of 7-day average cases, new cases per day per 100,000 is 13. This is nearly double the threshold for moving up to Tier 2, which requires that we have less than 7 new cases per day per 100,000 population. And even though the county's current test positivity rate of 5% puts us in Tier 2, red, for this metric, when the two metrics fall in different tiers, the state places counties in the most restrictive tier. Hence, Los Angeles County, like most counties in California, has been placed in Tier 1. Our path forward for recovery depends on us being able to reduce community transmission significantly so children and teachers can get back to their classrooms and more people can get back to their jobs with as much safety as possible. To put into perspective our progress in slowing the spread of COVID-19 across our communities, it's helpful to look at the trends line since April. If we can go to the next slide. This graph shows the 7-day number of cases per 100,000 people from April 1st through April 28th. As you can see, in early April, when all businesses except those that were essential were closed, we saw about 400 new cases a day, increasing to about 1,000 cases later in the month. A few weeks after businesses reopened, coinciding with the Memorial Day and July 4th holidays, we saw a rapid increase in cases, rising to over 3,000 new cases a day in mid-July. Since implementing additional modifications, including moving many activities outdoors and increasing compliance activities at work sites, we have seen that the number of new cases dropped to an average of 1,200 this week, or this past week. While this is good news, we're still seeing a ways to go in terms of too many new cases indicative of widespread. Let's go to the next slide. As we often mention, the test positivity rate is another good indicator of how we're doing at slowing the spread of the virus. In April, our test positivity rate was high at 15% because we were limiting testing to only people who had symptoms and were in high-risk groups. However, testing became far more available over the next couple of months, and our positivity rate dropped to about 5% in May. Unfortunately, by mid-July, after reopenings and holidays, where we saw many people in crowds, the positivity rate increased quickly and peaked at 9.5%. This month, we have seen a return to the test positivity rates we were seeing at their lowest point in late May. On August 22nd, the positivity rate in Los Angeles County was 5%. Again, this is good news, but we're still seeing way too many cases indicative of widespread. If we can go to the next slide. Hospitalizations have increased and decreased in relationship to cases. In early April, during Safer at Home, daily hospitalizations were at about 1,000 cases. Surges in hospitalizations happened twice, once in early May and then again in mid-July, when hospitalizations reached their highest levels on July 22nd with about 2,200 people being hospitalized. Currently, there are about 1,100 hospitalizations per day, which indicates a significant decline. In addition to a reduction in cases, two other factors may contribute to the decline. First, the fact that there are now younger patients that we're seeing in terms of cases, and there's actually improved treatments for treating COVID-19. Next slide, please. Tragically, as we've seen cases and hospitalizations increase, we also saw an increase in deaths. In early April, daily deaths averaged about 11 per day. As we can see, the number of deaths increased significantly following outbreaks at nursing facilities in mid-April and May, and then again following our case and hospitalizations peaks in mid-July. Although recently deaths have been declining, currently an average of 29 people lose their life each day in LA County to this devastating virus. As we approach the Labor Day weekend and as we plan how our county will reopen schools and more businesses, we must look at the lessons learned from our experiences these past 7 months. In order for transmission rates to continue to fall, workers need to be protected the entire time they're at work. Our most vulnerable residents in nursing homes need to be safe, and we need to continue to forego our traditional holiday traditions. We know for sure that our holiday gatherings, parties, and cookouts can result in increases in transmissions, hospitalizations, and deaths. The ability for us to reopen more fully relies on everyone doing their part, being smart of their choices, and reducing their risk to exposure of COVID-19 every day. Next, I'll briefly touch upon the trends that we're seeing in skilled nursing facilities. As we consider our approach to reopening, we must consider how people who are most vulnerable to serious illness and death are doing. Since the beginning of the pandemic, people who are 65 and older have been more likely to be hospitalized with COVID-19 when compared to younger people, and sadly have been more likely to die from the disease. Next slide. Across the county, skilled nursing facilities, assisted living facilities, and other congregate housing for elders were sites for early COVID-19 outbreaks, and this was true in LA County as well. In this slide, the green line is all the deaths in LA County, and the blue line is the skilled nursing facility associated deaths. This slide shows a steep climb in COVID-19 deaths among skilled nursing facility residents that peaked in early May and has seen a downward trend since then. It also shows that even though there was a second wave of increased deaths in late July and early August, skilled nursing facility residents have seen no such increase. Instead, skilled nursing facility residents made up only a quarter to a third of daily reported deaths since mid-July. Now I turn to our recovery metrics with a focus on health equity. All along, we have been reporting on data by race and ethnicity and area of poverty. We do this because too often the burden of disease is carried unfairly by people of color and of low-income individuals. If we are explicit about these disproportionate impacts, then we can tailor our response to address them. As we return to lower case rates, hospitalizations, and deaths in the county, and are looking towards reopening schools and businesses, we want to make sure that these improvements are shared by all residents in the county. As you've seen since early on in the pandemic, our communities of color and those in low-income communities are bearing the brunt of the virus, both in terms of infections as well as deaths. We continue to talk about this because the recovery journey won't be complete until we close the gaps, while at the same time improving health outcomes for all. Next slide. This slide is the daily age-adjusted rate of cases by race and ethnicity. The yellow line on top represents the Latino, Latina, or Latinx residents of the county. Just below that is the green line representing Black residents. White residents are represented by the orange line and Asian residents by the blue line. This slide very clearly shows the disproportionate impact of COVID-19 infections among Latino or Latinx residents, particularly through the month of July. However, we also see that this rate has been dropping since mid-July. This is good news. Last week, we saw that Latinx rates at the lowest point since the end of May, and we're hopeful that we will continue to see this downward trend in transmission. If we can go to the next slide. This slide shows the daily cumulative rate by area of poverty. In this slide, the orange line on top represents residents who live in areas with the highest rates of poverty. These residents have had the highest case rates since the beginning of the pandemic and continue to suffer the greatest disease burden compared to all other income groups. By comparison, people who live in areas with the lowest rates of poverty experience less than half the cases when compared to those who live in the highest rate of poverty. Next slide. This slide shows the age-adjusted hospitalization rates by race and ethnicity in the county. Similar to the slide for cases by race and ethnicity, Latino or Latina or Latinx residents, shown here in yellow line, represent or experienced a steep increase in hospitalizations in July, which had fallen back to pre-June levels by mid-August. Now, Latino, Latina, or Latinx residents have a hospitalization rate that is almost 4 times higher than that of Asian residents, who are shown in blue, and have the lowest rate of hospitalizations in the county. Just below the yellow line is the green line representing Black residents, who did not see the peak in hospitalizations, but have maintained a hospitalization rate that is more than 2 times that of both white and Asian residents. If we can go to the next slide. This slide shows us trends as we relate to deaths in racial and ethnic groups. Again, Latino or Latinx residents, sadly, have also been more likely to die of COVID-19 than other racial or ethnic groups. This chart shows deaths through August 22nd. It shows a steep decline in deaths among Latino or Latinx residents since early August. Again, we're hopeful that this trend will continue. Other racial and ethnic groups have fluctuated over the same period. We see daily deaths among Black residents, shown here in the green line, declining steadily since mid-July. Asian residents, shown in the blue line, increased slightly in July and early August, but seem to have declined again. And the orange line, which represents white residents, has consistently been lower than other racial and ethnic groups. If we can go to the next slide. Finally, I want to highlight the impact of poverty on deaths. Just as case rates are highest for those living in high poverty areas, so tragically are the death rates. This graph shows that individuals who live in areas with the highest rates of poverty, the orange line, have consistently experienced the highest rates of death. Those who live in the poorest areas of the county have a death rate that is more than 4 times that of those in wealthier areas of the county, shown here in the blue line. Today, we're sad to report additional 16 deaths today. 8 of those who died are over the age of 80, and 7 who passed away had underlying health conditions. 2 of those people who died are between the ages of 65 to 79, and 2 who passed away had underlying health conditions. 4 people who died are between the ages of 50 and 64, and 1 of those people had underlying health conditions. 2 of the people who died are between the ages of 30 and 49, and 1 of these people had underlying health conditions. This brings the total deaths to 5,784 in Los Angeles County. Our sincere condolences go out to everyone who is grieving a loved one or a friend who has passed away from COVID-19. Our thoughts are with you as always. 93% of the persons who died from COVID-19 had underlying health conditions. Again, I caution you, that means that 7% were healthy or did not have an underlying health condition. For the 5,443 people who passed away where race and ethnicity were identified, 51% are Latino, Latinx, 24% are white, 15% are Asian, 10% are Black, and less than 1% are Native Hawaiian or Pacific Islander, and 1% identified as another race or ethnicity. Today, we're reporting 1,022 new cases. This brings the total number of cases in Los Angeles County to 241,768. These cases include 10,492 cases reported by our partners in the city of Long Beach and 2,368 cases reported by the city of Pasadena, which have independent city health departments. We're reporting 1,583 confirmed cases among people experiencing homelessness. Among these cases, 441 were referred to isolation and quarantine sites to appropriately isolate for the duration of their illness. 1,043 confirmed cases are currently hospitalized. 33% of these people are confirmed cases in the ICU or the intensive care unit, and 19% are on ventilators. We have investigated a total of 1,608 residential congregate settings and non-residential settings with at least 1 confirmed case of COVID-19. Of these, 825 are being currently investigated, and 783 are closed investigations. Residential settings include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. Non-residential settings include workplace, food and retail, and educational settings. The total confirmed cases in institutional settings is 32,107, including both staff and residents. 16,364 of these confirmed cases are residents, and 15,743 are staff. We are sad to report that 2,597 residents in institutional settings have died from COVID-19. 2,346 of these people who died in institutional settings resided in skilled nursing facilities. Of the 16 newly reported deaths today, 19% were skilled nursing facility associated deaths. Again, our hearts are with those, everyone who is grieving a loved one or a friend who were lost to COVID-19. Again, we are so sorry for your loss. We are reporting 3,555 confirmed cases at some point in jail facilities, 3,153 among people who are incarcerated, and 402 among staff. There are 243 cases in the state prison, 183 among people who are incarcerated, and 60 among staff. There are 758 cases in the federal prison, 742 among people who are incarcerated, and 16 among staff. And 142 cases in the juvenile facilities, 60 among youth, and 82 among staff. Almost 2.3 million people have been tested and had results reported in Los Angeles County. And our positivity rate for all of those tests remains at 10%. In closing, as we're coming up on Labor Day weekend, I want to share with you tips for celebrating as safely as possible. It's likely going to be a hot weekend, so be sure to take precautions to avoid the hottest part of the day and keep cool. First, only gather with members of your household this holiday weekend. There's so much more to do together in our beautiful county. Explore a trail or have a picnic at one of our beautiful beaches early in the day. If you're outside of your home and around others, please wear a face covering. Always use your own utensils, cups, food, and drinks, and do not share with others. Avoid crowds and be flexible and willing to change plans or move to a different location if you find yourself in a crowded area. And once again, avoid confined spaces, especially places where you can't stay more than 3 steps away from others if that's not possible and others aren't wearing face covering. And if you're sick and have been exposed to someone who is positive for COVID-19, please stay at home, isolate, and quarantine as appropriate. Remember, these actions save lives. And now we'll take questions.
To ask a question over the phone today, you may press 1 and then 0.
We'll go ahead with the first question.
Thank you. Claudia Peshudia, KNX News Radio.
How many homeless deaths reported at this point? And also, if the state is saying it's okay to reopen malls at limited capacity and resume indoor operations at barbershops and salons, why are you not updating the county's health officer order? Thank you.
I'll let Dr. Davis answer the first part. The second part is our board will be discussing with Dr. Ferrer tomorrow the protocol moving forward. We recognize the state has allowed us to open, and we want to do it in a very thoughtful process. So tomorrow we will be discussing it and make announcements, hopefully by early afternoon. Dr. Davis in the first part.
Thanks for the question, Claudia. So we currently have 40 deaths in persons experiencing homelessness. We didn't have any new deaths reported recently, but that's where we are at the moment. Thank you.
Next question.
That'll come from the line of Colleen Shelby. Please go ahead.
Hi, thanks for taking my question. Dr. Davis, you had mentioned last week that county officials had talked to local officials about Labor Day. I'm just wondering if there's any further conversations that have come from that, any concerns that have been raised at the city level, and if LA County plans to make any updated changes this week in regards to beach access or other outdoor activities.
Good question. Dr. Davis? Yeah.
You know, I appreciate that question. We do continue to watch our data to see what it looks like and to see if there's you know, any increased risk. I mean, again, I do remind you that we still have widespread transmission. So we'll continue to be in discussions as we continue to move forward. We'll always continue to watch our data. Thank you.
Next question, please.
Our next question comes from the line of Ryan Carter. Your line is open.
Go ahead.
Yes, thank you, Doctor. This is Ryan here at the Daily News. It's been reported today that the new White House public health advisor has been pushing the idea of herd immunity policy. And I wondered if you can kind of remind us where LA County Public Health stands on herd immunity. And the second question is just on schools. I wasn't fully clear about what the new state guidance means for how long schools would have to wait to reopen. Thank you.
Thank you.
Thank you for that question. I think the herd immunity, just to remind people, is generally when you get an infection and you have some immunity built up and are protected from that infection. Having a certain percentage of people inside of our county who have already had the infection and have that natural protection is what we're talking about in terms of herd immunity. I don't think that we have, and there's been some evidence that people can be reinfected. We've had one case inside of the U.S. That is pretty convincing that there is the possibility of being reinfected with this virus. So at this point, I think the question of herd immunity remains to be seen, and we have to continue to look at that data. In terms of schools, the waiver program is still available to us. It is also still available, the guidance related to small cohorting of schools. And all of that, again, will be discussed with our board as we think about where we are with cases and what we will need to do moving forward. But in general, what I will say that when you're in a tier related to the tiered framework that the state has put out, you're intended to be in that tier for at least 3 weeks before you can change. And that is, again, to see how your data changes as you move forward with any changes inside of your jurisdiction, but really to pay attention to what's happening and be able to adjust as needed. Thank you. One more question, please.
We'll go to the line of Jackie Fortier. Please go ahead.
Go ahead, Jackie.
Hi. Dr. Davis, you said enforcement at workplaces was one of the reasons that cases have decreased. Do you think that there should be fines levied against people who don't wear masks in public in LA County, especially coming up with the holiday weekend? Do you think mask enforcement should be stricter in public spaces?
It's a good question, and I think one of the things in all of this is we're not going to enforce or find our way out of this. I do think that when people really understand why they're wearing a face covering, which is really to protect others, because you don't know if you're going to have the virus or if you do have the virus and can transmit to others. So I think the more that we talk with people, the more that we see evidence, and we have over the course of this pandemic, that face coverings do help. We hope that more people take that up. There are some jurisdictions in some cities that have taken to that. So I think this is a jurisdiction by jurisdiction discussion, in terms of moving forward in that way. But the really is that people just need to do it, and it is something that is protective of all of us. Thank you. Now let's move to remarks in Spanish. Thank you.
Buenas tardes. Gracias por acompañarnos hoy. Queremos hablar con ustedes sobre el nuevo marco de referencia que lanzó el Estado y cómo esto impacta al condado de Los Ángeles. Y también cómo impacta nuestro proceso de reapertura. También queremos mencionar un poco sobre lo que dijimos la semana pasada y la importancia de aprender de nuestro reciente pasado, de tomar acciones que van a evitar el aumento en casos, hospitalizaciones y fallecimientos, especialmente a medida que se acerca el fin de semana para celebrar el Día del Trabajo, conocido como Labor Day. Can I get the first slide, please? El viernes pasado, el Estado anunció un nuevo marco de referencia con varios niveles para poder comunicar más fácilmente el nivel de transmisión comunitario en los diferentes condados del estado. Este gráfico muestra un resumen de los niveles del estado, los indicadores de cada uno y cómo se clasifican los condados, ya sea con propagación del virus COVID-19 generalizado, sustancial, moderado o mínimo en las varias comunidades. El sistema de niveles que se va a usar va a guiar las posibles reaperturas de cada sector para que cada condado lo considere. Sin embargo, las decisiones finales sobre las reaperturas de cada sector permanecen bajo las órdenes del oficial de salud locales, que se desarrollan en consulta con nuestra Junta de Supervisores. Next slide. El condado de Los Ángeles se encuentra actualmente en el nivel número 1, lo que significa que continúa habiendo una transmisión generalizada del virus en el condado. Nuestro número actual de casos nuevos por cada 100,000 personas es 13, y esto es casi el doble del inicio para pasar al nivel 2, puesto que se requiere que tengamos menos de 7 casos por